In this final video, we're going to look at close cousins of the streptococci, the enterococci. For all intents and purposes, these are streptococci that live in the colon. But in recent years, we've discovered that they really do belong in their own genus, even though for all intents and purposes, they look really similar. Now, there are two species of Enterococcus that are particularly important in human health, Enterococcus faecalis and Enterococcus faecium. Both of them have the root of feces, and so you get the idea, right? These guys are good indicators of polluted water, of feces polluted water, and they are good inhabitants of our lower descending colon. Now, the good news is, as long as they stay there, they don't cause any trouble at all. They're just minding their own business. Normal flora of the GI tract. In fact, they're helping by producing bacteriocins. If you don't remember what bacteriocins are, go back to our discussion of microbial antagonism and see where bacteriocins fit in. Obviously, gram-positive cocci, found in pairs or short chains like the streptococci, also non-motile, non-spore-forming. One distinction between the enterococci and the streptococci, though, is that these enterococci are tolerant to much harsher conditions, much more anaerobic conditions, right? Where the streptococci do just fine without oxygen, the enterococci actually need what's called reducing conditions, so beyond no oxygen, if you can imagine such a thing. They can also handle bigger temperature variations, from warmer to colder, so they have a broader range of temperatures. They can tolerate broader range of pH and salt, and then very importantly, they can tolerate a lot more bile than your typical streptococcus can, and bile is important in the intestinal tract for absorbing fats, and so bile can be pretty toxic to many bacteria. The enterococci do really well in the presence of bile. The primary diseases when enterococci do cause disease are bacteremia, endocarditis, and then wound or surgical infections. These are almost always opportunistic infections where the host, the patient's own bacteria have been given an opportunity to attack them, getting into the bloodstream, attacking the heart, or getting into other tissues like the abdominal cavity due to typically surgery or some sort of a trauma like a bullet wound, a car wreck that ruptures the abdomen, etc. Now, one of the scary things about them is that they are very frequently multi-drug resistant naturally. And then we're seeing more and more vancomycin-resistant enterococci emerging. And this is becoming a scary prospect, but something that needs to be on our radar so that we can keep an eye out for it. Fortunately, it's still not common, but multi-drug resistance in general is common. So those are the enterococci.